Hi, my name is Jennifer Woyach from The Ohio State University, and I'm here with Dr. Skarbnik, who is going to discuss one of his abstracts from the 2024 ASH annual meeting. Hi, Alan.
Hi, how are you doing? I'm Alan Skarbnik from Novant Health, and happy to be here.
Thanks for being here. We're excited to hear some more about your abstract. So if you wouldn't mind telling us about this abstract entitled Mutations in the BTK gene in patients with chronic lymphocytic leukemia receiving BTK inhibitors.
Of course. So as we all know, BTK inhibitors have been used for now over 10 years since it was approved for the treatment of CLL, and obviously before that in clinical trials with tremendous levels of success. But unfortunately, a number of patients present progression of disease while they're taking it, and you all at Ohio State have done a lot of study on understanding the mechanisms by which this type of resistance occurs, and CLL in particular seems to be driven in a good number of patients by mutations to the BTK molecule, largely, as we know, to the C481 residue where the BTK inhibitors tend to bind to, but other mutations arise in their questions of potential resistance to the non-covalent BTK inhibitors. So this was a large study, a retrospective study with multiple centers, where we looked at all patients who had mutation, a BTK mutation panel sent to NeoGenomics over a number of years, who were on a BTK inhibitor, and for whatever reason, the mutational panel was sent to them. So we're over 13,000 patients who were evaluated in the study, close to 14,000 patients. Unfortunately, only 238 of those patients were found to have BTK mutations. So a very low number across the number of patients who were submitted and were taking BTK inhibitors. And as suspected, the majority of the mutations were on C481, which was already known. And these patients all were taking ibrutinib and acalabrutinib the period of time Xener wasn't yet approved. Neither was pirtobrutinib during the period of time that this patient data was submitted. And there are concerns about looking into other types of mutations, particularly gatekeeper mutations. And the frequency of those mutations was quite low. And the T474 mutation, for instance, which is one that is of concern with cross resistance, only occurred in 8 patients out of the 13,000 who were submitted. Now, another interesting feature here is that most patients who did have a BTK mutation, or close to half of those patients had a BTK mutation, also had a mutation in TP53. So 45%, give or take, of the patients with a BTK mutation had a co-mutation in TP53, which we know increase the risk for progression and resistance to multiple therapies, including BTK inhibitors. And most of these patients who had their data submitted were receiving BTK inhibitor in the front line. There was about 80% front line and 20% relapse setting, where we do expect the upfront rate of TP53 mutation being about 10%. So it is much more enriched in this population who developed a BTK mutation. So trying to understand the interaction between those molecules is an interesting path moving forward. So a lot of food for thought. I think it may help drive how we look into these mutations moving forward. But you know, it's nothing that will guide any type of therapeutic decision at this point based on the data. But it's interesting to see that, well, reassuring, I think, to see that at first the rate of mutations is quite low, particularly the gatekeeper mutations. What were your thoughts?
I think it is a very interesting study. Of course, difficult without a lot of granularity behind the patient characteristics. But certainly very hypothesis generating, and we really look forward to more research coming out of this data set. It's certainly a particularly rich area where we can look at more patient samples.
Great.
So
Thank you
thank
very
you very
much.
much.